নমস্কার, আপনারা দেখছেন নিউজ 18 বাংলার সঙ্গে রয়েছি আমি লাবণ্য এবং আজকেও আরো একটা আলোচনায় অংশগ্রহণ করতে চলে এসেছি। কিন্তু আমি একা নই, আমার সঙ্গে রয়েছেন এমন একজন বিশেষজ্ঞ যিনি স্পাইন সার্জারির দুনিয়ায় এবং রোবটিক স্পাইন সার্জারির দুনিয়ায় বলা ভালো এক নতুন দিগন্ত খুলে দিয়েছেন আমাদের জন্য, মানে সাধারণ মানুষের জন্য। প্লিজ ওয়েলকাম আমার আজকের অতিথি ডক্টর এস Vidyadhara, Chairman and HOD, Spine Surgery, Manipal Hospital, Old Airport Road, Bengaluru, right?
Yes.
Welcome to News 18 Bangla, sir.
Thank you.
Sir, spine surgery. This name is a bit scary for us. It sounds maybe a bit scary for us, and especially the robotic spine surgery. वो क्या है ना कि नाम सुनने से ही डर लगता है, डर जैसा फील होता है। लेकिन आप हमें जरा ये बताइए कि मोस्टली कॉमनली आप जो पेशेंट्स को ट्रीट करते हैं तो उनमें कौन कौन से प्रॉब्लम्स आप डिटेक्ट करते हैं जिनको स्पाइन सर्जरी के अर्ली प्रॉब्लम्स हम कह सकते हैं?
सी प्रॉब्लम तो जन्म से आ सकता है, व्हाट वी कॉल एज कंजेनाइटल प्रॉब्लम्स. सेकेंडली लाइक डेवलपमेंटल प्रॉब्लम विच कम इन चिल्ड्रन बिटवीन 10 and 15 years of age. These are basically deformities of spine. माने बेके जाबे, पीठ कमर बेके जाबे, and that starts affecting the growth. As we grow, it instead of growing straight, it grows crooked, and during the growth spurt it becomes more and more, and it may need intervention, and this is painless and especially very important because these are children. Left alone, it leaves behind a mark in the whole of their life. So here I want to make a point. Scoliosis is a painless condition which, if undetected, can be a disaster in later life. Detected early, less than 25 degree, you can just observe. If it is between 25 and 45 degree, you can brace them, exercise, they can be controlled. More than 50 degree, it needs surgery, early surgery. Beyond 50, you don't wait for it to become 90 degree, because most often we get patients who are coming at a very late stage with lung problem, heart problem and back pain. I think that is the awareness that is needed in today's world. The second group is between 20 and 40 years of age, wherein because of various jobs that we are doing, mostly sitting jobs, people are tending to have early degeneration of the disc, and especially people from Bengal that I notice, because we have get almost like maybe 40-50% of patients from Bengal coming to Bangalore for treatment, and most of them have nicotine related addictions, whether it is tobacco, BD, cigarette and all that. Yeah, and that has got a direct role in accelerated disc degeneration, giving rise to early back and neck pain. And thirdly, between 40 and 60 years of age, all the body tissues become loose. The spinal column has got muscles and ligaments around which they become loose and they start wobbling. The bones become wobbly, and that causes slip of the bone, what is called as spondylolisthesis, which is typically seen between 40 to 60 years of age, and that can cause compression of nerves with giving rise to symptoms in the legs like numbness, weakness and pain in the legs. And there is another category of people who are older than 60 years who develop brittle bones, osteoporosis, because there is no awareness that after menopause people, ladies especially, have to take calcium supplements, and beyond 70 they need to take 2 tablets of calcium every day. And last but not the least, today there is a boom of cancers all over, and the first spread of any cancer goes to the bone, and among bones, spine is the commonest. 50% of metastatic bone disease is in the spinal column, and lot of people come to us with back and neck pain and get diagnosed that they have a cancer which is somewhere else, like kidney, liver, thyroid and whatnot. So these are the different age spectrums wherein you have different pathologies which may need intervention or treatment.
So you cater patients across all ages, as you told me earlier, but what are the differences between in early stage or in a middle age or in a young people?
The pathologies are different, the risk is different, the amount of correction that you get is different, and the expectations are different. Like in a child, if it is a bent child, you correct it, they become straight and they don't even know that they had undergone a surgery. They become all right and they just walk around normally within 4 hours, 6 hours, and they go back to school in 2 weeks, 3 weeks. And especially with technological advances, the things have become much safe. You were mentioning in the previous question that it's so scary that spine surgery. Those days are gone. That was in 1980s and 90s or before that spine surgery is equal to half patients getting bedridden or paraplegic.
Right.
Now those things are not happening. Maybe happening in remote places where there is a less access towards medical technology and
proper
corporate
infrastructure
hospitals.
maybe.
Yeah. Otherwise, that paralysis risk is hardly there unless the disease can paralyze them but not the surgery.
Okay.
And today technology
So that is
has
very
a
important.
big,
The disease can paralyze someone but not the surgery.
yeah, absolutely. In experienced hand, in dedicated hands. Like we have everybody doing surgery, but if you go to the right place with the right doctor, I think the disease only can paralyze you, not the doctor.
Okay. And what are the alarming early signs that we have to be careful and we are not ignoring those signs?
See, basically we have pain, which is the commonest problem. Like there is nobody who doesn't have back pain and neck pain, isn't it?
People who are suffering with pain nowadays, they are very used to with regular painkillers and all.
So 8 out of 10 of us will develop back pain at some point of time, but it is not that everybody needs surgery. Having said, there are some red flags for us, like weakness of limbs. If somebody develops हाथ नहीं उठा सकता है, चलने को नहीं होता है, कमजोर है, he trips, he buckles his knees. These are red flags. That means there is a weakness in the limb. That means electricity is not flowing from the brain to the particular muscle. Or if there is loss of control of urine and motion, you are not able to pass or you are not able to hold. Both are equally bad. That means there is a disconnect between the brain and the organ, end organ. These two are medical emergencies wherein a surgeon has a right to sell surgery. Irrespective of who you are, where you are, every doctor will tell you surgery, and it's earlier the better outcome. The third indication for any intervention is functionally disabling pain for more than 3 consecutive months.
Okay.
That means naturally, if you ask me, pain is a protective reflex. It says that there is an underlying injury. Now, if you really look at pain perception, each one has a different perception. Your too much pain and my too much pain is different too much.
Exactly.
So there is a psychological component, there is a physical component. So each one's expectation and ability are different. So at 80 years and at 20 years, the expectations are different, your disability is different. So if you feel you are disabled by pain, it's more than 3 months. Natural healing takes 3 months, and if it is not healing, then you need to resort to going to a doctor, doing MRI, directing your intervention to the particular problem.
Okay. So जैसा कि आपने बताया कि limbar issues and bulging and pain and all, these are the early alarming signs. But ऐसा क्या हो सकता है कि कुछ patients में there are some comorbidities like heredity problem or diabetic से जैसे हम लोगों को कभी-कभी ऐसा सुनने में आता है कि RA factors high हो जाते हैं और उससे भी pain and other problems increase हो जाता है. तो स्पाइन के जो प्रॉब्लम्स हैं, क्या ऐसे कोमॉर्बिडिटी से अफेक्टेड होते हैं ये?
Of course.
Okay.
Pain is multifactorial, back pain. जैसे कि मैं बोला, there is a physical component of pain, there is a psychological component of pain, there is other diseases like diabetes से neuropathy होता है, diabetes से myopathy होता है. Means there are lot of pathies for the diabetes. But having said, the biggest problem is stress. In today's world, people are under tremendous stress for whatever reason and no reason also. किसी को काम है तो भी problem है, नहीं है तो भी problem है. तो we are living in a stressful world, and I think that affects pain perception. You understand what I'm saying?
Okay.
Physical pain is when you get cut, you feel pain because there is an injury. Body's reflex response. It's a friend telling you हाथ निकालो वहाँ पे नहीं तो कटेगा. अभी you getting tears in your eyes, you getting angry, you slapping your friend that is the psychological expression of pain. So when you are under stress, you feel the pain more. अभी IPL का क्रिकेट का फाइनल हो तो कटेगा तो भी पता नहीं चलेगा, अगले दिन पता चलेगा अरे कहाँ कटा, किसने
Your adrenaline was so high.
You don't realize. Whereas stressful life है, एक दिन पूरा अपसेट होके आए हो, थोड़ा भी ऐसे हाथ से भी ऐसे कटेगा तो गुस्सा आता है, दर्द करता है, रोने लगते हो, चिल्लाने लगते हो, because it pains. And if you're not like this, if your mind is not like this, you're mad. That's how.
अगर कुछ भी feel नहीं हुआ तो मतलब कुछ तो बहुत ज़्यादा गड़बड़ है.
So there is this thing that your mind works in a certain way that you don't have control, and when you are under stress, you don't realize that you are feeling the pain because you are under stress. much more, and if you are having a cool day, you would have not felt that much.
Okay, now let's come to the robotics part. Robotic spine surgery is becoming a buzzword now. तो आप इस बारे में हमें थोड़ा डिटेल में बताइए कि स्पाइन सर्जरी तो that was okay, ठीक है, चलो किसी को प्रॉब्लम है तो if needed we'll go for a surgery. But robotic spine surgery, is it a very complicated something, or robotic surgery is lesser pain or something?
नहीं, see basically every surgical specialty has evolved over a period of time. Like पहले एक जगह से दूसरी जगह जाने का है तो मैप देखते थे, बाद में जीपीएस, अभी लाइव जीपीएस है जहाँ पे बोलेगा कहाँ पे धरना हो रहा है, कहाँ पे रैली हो रहा है, कहाँ पे रोड ब्लॉक है, कितना देर लगेगा, ये रोड से वो तो लाइक दैट इन सर्जरी आज के दिन पहले हम सीटी स्कैन करके ओटी को लेके आते थे, अभी पेशेंट को पोजीशन करके वहीं पे सीटी स्कैन करते हैं, प्लान करते हैं और एग्जीक्यूट करने में हमारा ड्रिल जहाँ जाता है हम स्क्रीन में देखेगा कि ओ इधर जा रहा है, इधर जा रहा है, हाँ स्पाइनल कॉर्ड इधर है, आर्टरी इधर है, तो देख देख के करते हैं. इट इज़ लाइव, सो यू आर वेरी वेरी श्योर दैट दिस इज द वे. सो फ्रॉम कन्वेंशनल सर्जरी वी वेंट ऑन टू मिनिमल इन्वेसिव स्पाइन सर्जरी to navigated spine surgery, and today combination of minimal invasive with navigation is robotic spine surgery.
Okay.
It has added lot of value to surgeon's experience. It is not replacing the surgeon, but it is adding value, adding safety, adding confidence in surgeon's outlook to surgery and patient's faith in the surgeon. And this is like from somebody who was using manual car and driving a automatic car. You feel so comfortable because all the drills, taps, the screw handles, everything is power driven, and you have a handle which will hold and make sure that this hand doesn't slip. So we did a lot of studies in this, and we are actually not just having done 1,000 surgeries, but we have published our results in international index journals, 10 of them, with different concepts and different research questions, and one of which is saying that if you do before 2 p.m. and after 2 p.m. the surgery, the accuracy is the same. That means the fatigue factor doesn't account to hand slipping and going and doing some problem for the patient. So it enhances the safety of the spinal surgery for the patient.
So we can call it as almost a flawless surgery process.
Absolutely.
Okay.
And we have our results proving that the accuracy of screw placement, planned and executed trajectories in thoracolumbar spine, माने नीचे का हिस्सा बॉडी का जहाँ पे pedicle are little bigger, so is to the tune of 99.8% from our study, and in the cervical spine, which is unexplored area by the rest of the world, and we have done 63 cases and we have published the result wherein the accuracy is to the tune of 98.3%.
Okay. So patients में एक post operation surgical जो syndrome होता है वो काफी अलग होता है, मतलब ठीक है ऑपरेशन तो हो गया, now let's back to the normal life, ये कैसा रहेगा इस प्रोसेस में? अगर कोई स्पेशलिटी है तो हमें ये भी बताइए, क्योंकि क्या होता है कि पोस्ट ऑपरेटिव केयर इज वेरी इंपॉर्टेंट इन दिस स्पाइन सर्जरी एंड स्पेशली रोबोटिक स्पाइन सर्जरी.
देखिए बेसिकली इसमें बहुत सारा माइंडसेट के ऊपर है.
ओके.
बिकॉज इनिशियली क्या था, सभी के लिए रेस्ट था. हाँ. आप प्रेगनेंसी हो, नॉर्मल डिलीवरी हो या सिजेरियन हो, रेस्ट वाज द 5th लार्जेस्ट रिलीजन. आफ्टर हिंदू, मुस्लिम, क्रिश्चियन, सिख वाज बेड रेस्ट. सभी को लगाओ. ज्यादा इरिटेटिंग पेशेंट है तो लंबा रेस्ट दो, ताकि वो वापस आएगा तो पूछो आपको रेस्ट बोला था 3 महीने क्यों आए, नहीं तो बहुत बकबक करता है ना, तो इसीलिए. तो बट टुडे व्हाट हैज हैपेंड इज, टुडे वी डोंट बिलीव इन रेस्ट एनीमोर. वी से एक्टिव रेस्ट. Do everything but be within pain limits. Don't provoke pain, don't increase your pain during healing period. So we really talk to patients a lot. We create a mentality that they should walk within 4 to 6 hours after surgery. They stay only 1 day, 2 nights after surgery, and they come back for one dressing. They go back to their hometown or country in 10 days, and they join back work in 3 weeks. Compared to conventional surgeries where people were put on bed rest for 3 months, 6 months of off from work.
That's why I'm asking you.
Yeah. Now things have changed.
Speed up the process.
It is one, because robotic surgery is minimal invasive, less tissue trauma, less blood loss, more accurate, less complications. You name it, it is there. Other than the cost.
जो लोग रिमोट एरिया, रिमोट पार्ट ऑफ द सिटी, रिमोट पार्ट ऑफ आवर कंट्री रहते हैं, उनके लिए कितना एक्सेसिबल है और या कितना अफोर्डेबल है?
See, compared to a regular surgery that we do, this cost maybe $1 lakh more.
Okay.
And I think for this area that we are dealing with, wherein spinal cord, if you get any damage or any injury, even galti se bhi, you are risking the whole life. Spinal cord injury is irreversible. So that 1 lakh I think is priceless.
Okay.
I would say I would do anything but get a surgery done robotically.
Okay. Thank you so much, doctor, and you have highlighted in every possible point that the point are raised. हाँ, क्वेश्चन ये शेष हो गया हमारे सर सब बोले दिए थे।
मैं बोलता दो और पॉइंट है।
ओके, ठीक है। तो रिकवरी के बाद क्या क्या करना होता है?
नहीं, बेसिकली सी, although today we are in a world where robotic is really picking up and doing everything right for the patient and the surgeon, today we say that in my 30 years of being a doctor, what has not changed is indications for surgery and principles of surgery. Means because you have a robot, you don't do unnecessary surgery.
Right.
Indications are only 3: weakness, bowel bladder involvement, or functionally disabling pain for more than 3 months. That was the same in 1990 and 2025. Principles of surgery, only 2 in most of the cases. If a nerve is pressed, you decompress. If a bone is slipped, you realign and fix them. So other than this, the technology assists you to make your surgery better, but it cannot replace the surgeon, because what computer doesn't have is the sixth sense. When you're going, say you are drilling a nail into a wall, into a block or into a brick. You know the feel when it goes into the brick, you know the feel when it gives off in a cement block. So similarly here, when you go into a bone, you have the feel which a surgeon would have felt in the last, say, 25 years. And when you miss, you don't go and hit something spinal cord. You know that you are not in, and you just abandon. So that judgment which a surgeon can do, a computer can never replace. And that's why I feel it may advance to whatever level. I don't see, at least in spine surgery, that it can replace me, at least till I retire. After that, you never know.
So as a surgeon, you have done countless surgeries, but till date, did you have any special experience with any particular patient or something?
Oh, many. Every patient gives us an experience for life. Okay. Because they are so cute and so innocent, and you know, they actually, they don't really, and we also don't sell so hard about robotic and all that. I talk about principles of surgery. Like I said, your nerve is pressed, we have to decompress. Your bones are slipped, you have to. And the hospital representative will talk about the options of robotic and non-robotic, but ultimately patient will only ask whether it is X amount of money or Y amount of money, and you are like, oh my God. Finances do drive a lot of decisions in patient's mind, not just the technology. But yeah, today there is hardly any competitor in the market to sell these robots, and one day I think if there are more competitors and maybe Indians can come up with more and more robots, I think it can become much cheaper because of competition, and it should be a must-have for any spine surgeon to do spine surgery, so that everybody, whether you are rich, poor or middle class, should get safety. I don't think that anybody should be deprived of the state-of-the-art infrastructure in doing spine surgery. It's everybody's right, everybody deserves it, and I think only competition, healthy competition among the industry should bring the prices down, and everybody can benefit, both doctors and patients alike.
So spine surgery is maybe affordable within the next 5 years for everyone.
I am sure the kind of engineers that we have, I think we should be there in not beyond 5 years. I think it will come down to a place where every hospital should have a robotic spine surgery, so that patients get the same treatment irrespective of your financial status. And it should be like you should have. It comes in the whole package, not that robot is charged separately extra 1 lakh rupees. Okay. I think that should be the dream for any patient and the doctor like me.
আমাদের সঙ্গে ছিলেন ডক্টর এস বিদ্যাধারা, এইচওডি অ্যান্ড চেয়ারম্যান মণিপাল হসপিটাল ব্যাঙ্গালুরুর পক্ষ থেকে, একজন স্পাইন সার্জন যার চোখ দিয়ে আমরা বা যার কথা শুনে আমরা বলা ভালো ভীষণ ভালোভাবে জানতে পারলাম যে রোবটিক স্পাইন সার্জারি কি ব্যাপক হারে একটা বিপ্লব ঘটিয়েছে স্পাইন সার্জারির দুনিয়ায়, এবং আগামী আর কয়েক বছরের মধ্যে হয়তো এই ধরনের স্পাইন সার্জারি সাধারণ মানুষের জন্য কতখানি অ্যাফোর্ডেবল এবং সহজলভ্য হয়ে উঠবে বাংলার তথা ভারতবর্ষের প্রত্যেকটি রাজ্যে। অনেক অনেক ধন্যবাদ স্যার আপনাকে, এবং অনেক অনেক ধন্যবাদ আমাদের দর্শক বন্ধুদের আমাদের সঙ্গে থাকার জন্য।